everyone, and welcome to The Explainer. Today, we're going to explore Parkinson's disease, and we're taking a truly fascinating micro to macro journey to do it. We're going to start by zooming all the way in to look at the microscopic brain chemistry that actually triggers this condition. And then we're going to steadily zoom outward, tracing how those tiny biological changes ripple out to affect a person's everyday living, their diagnosis, and their treatment. So, whether you're a student, a caregiver, or just a deeply curious learner, this structured journey is going to give you an incredibly clear picture of how Parkinson's actually works.
Okay, let's dive right into this. Here is our roadmap for the explainer. We'll start inside the brain, move on to causes and risk factors, recognize the symptoms, map out the diagnosis and progression, explore treatment strategies, and finally, talk about what it actually means to live with Parkinson's.
Section 1, inside the Parkinson's brain, the microscopic origin. We need to look deep inside the intricate wiring of the human brain to understand where this all starts. To ground ourselves, let's look at the clinical definition. Parkinson's disease is a progressive neurological disorder affecting movement, developing when specific brain nerve cells gradually stop producing enough dopamine. What is absolutely vital to grasp here is the core paradox of this disease. You see, it begins as a completely invisible microscopic failure deep within the brain, but over time, it creates highly visible, life-altering macroscopic effects on the body. Think of the chemical dopamine like the master conductor of your body's orchestra. In a healthy brain, this conductor ensures that all your body movements are smooth, coordinated, and perfectly timed. But in a Parkinson's brain, the specific cells that produce that dopamine, which are located in an area called the substantia nigra, well, they gradually die off. When the substantia nigra fails to produce enough dopamine, the body's orchestra loses its conductor. Now, the music doesn't stop entirely, but it loses that smooth coordination, resulting in the movement problems characteristic of the disease. Section 2, causes and risk factors. So, who is actually affected by this condition, and what triggers it? Age is absolutely the most prominent metric here. The vast majority of people affected by Parkinson's are 60 years old or older. Now, early onset Parkinson's can rarely happen before the age of 50, but the risk threshold drastically increases as people cross that 60-year mark. The data also tells us that males generally have a higher risk of developing the disease than females. Now, what's really interesting about this slide is the sheer variety of potential triggers. It's incredibly complex. We have aging, of course, but also genetic factors and family history. Then there are external factors like environmental toxins and pesticide exposure, previous head injuries, oxidative stress, and the abnormal accumulation of proteins in the brain. But here's the major takeaway. While all of these varied factors can contribute to the risk, the exact cause is still not fully understood. In fact, most cases of Parkinson's occur without one clear identifiable cause. It's usually a complex interplay of these elements. Section 3, recognizing the symptoms, the visible impact. This is where the disease truly makes its impact known on a human level. Because the body locks its dopamine conductor, we see highly visible motor issues, tremors, which often start on just one side of the body while at rest, bradykinesia, which is a clinical term for the slow initiation of movement and slow walking, painful muscle rigidity, and postural instability that leads to poor balance. But you know the non-motor symptoms are just as impactful, even though they're largely invisible to an observer. The dopamine deficiency heavily affects a patient's internal world, causing depression, anxiety, severe sleep disorders, debilitating fatigue, memory difficulties, and even a reduced sense of smell. Parkinson's is, for sure, far more than just a movement disorder. To truly understand how pervasive this disease is, consider these two surprising symptoms. First, micrographia. This is where a person's handwriting becomes progressively smaller and cramped. And a mask-like face, where the muscles of the face become rigid, resulting in a significantly reduced facial expression, a soft, monotone voice, and even slurred speech. This brilliantly illustrates a mini-narrative of the disease. The dopamine deficiency affects literally everything, bleeding into even the smallest, most intimate daily actions and human communications.
Section 4, diagnosis and progression, mapping the journey.
So the crucial point here is this. There is currently no single blood test that can confirm Parkinson's disease. You can't just draw blood and get a definitive yes or no. Instead, the diagnostic process requires really sharp clinical observation. Doctors have to rely on a thorough medical history, detailed physical and neurological assessments, and observing the symptoms over time. They'll often use MRI and specialized imaging, not necessarily to see the Parkinson's itself, but to explicitly rule out other conditions that might be mimicking it. It's like a giant puzzle they have to solve. Let's move on and see how this builds across a timeline. Parkinson's generally progresses through stages. Stage 1 is the early stage, characterized by mild tremors and minimal disability. Stage 2 is the moderate stage, where stiffness increases and balance problems become way more prominent. Finally, Stage 3 is the advanced stage, marked by significant mobility limitations and a heavy dependence on caregivers. But please remember, while this timeline gives us a structural map, the actual rate of progression varies incredibly widely from person to person. Section 5. Comprehensive Treatment Strategies. Restoring Control.
And this brilliantly illustrates the multi-pronged approach medical professionals use today. Step 1 focuses on medications. The gold standard here is Levodopa, which acts as a powerful, direct replacement for the missing dopamine in the brain. They also use dopamine agonists that mimic dopamine alongside MAOB and COMT inhibitors to help preserve and extend the medication's effects. Step 2 is physiotherapy. This is absolutely crucial for improving mobility, reducing the risk of falls through balance and stretching routines, and utilizing aerobic exercise. And Step 3 utilizes occupational and speech therapy. This helps patients conserve energy, use adaptive equipment for daily activities, and actively rehabilitate their swallowing and strengthen their vocal cords. It is a full-spectrum defense.
Finally, Section 6. Living with Parkinson's. Managing the future. We have to honestly acknowledge that the long-term complications of this progressive disease are heavy. They can include severe falls and fractures, dangerous difficulty with swallowing, which can lead to pneumonia, as well as cognitive decline and depression. However, the management strategies are incredibly proactive. While there's no guaranteed prevention for the disease itself, managing these complications heavily relies on lifestyle factors. Maintaining a healthy diet, committing to regular exercise, enforcing good sleep habits, and actively maintaining brain health, these are absolutely paramount to fighting back against the decline. Which leads us to probably the most critical question of this entire explainer. When faced with this loss of dopamine, the varied symptoms, and the progressive timeline, can Parkinson's patients live a normal life? Well, the medical consensus offers a resounding message of hope. Parkinson's disease is a progressive neurological disorder, but early diagnosis, proper medication, physiotherapy, exercise, and family support can significantly improve quality of life. Many people with Parkinson's live productive, deeply meaningful lives for years when properly treated and monitored. Understanding the mechanics of the disease is the very first step toward effective management. But as medical science rapidly advances, from new gene therapies to deep brain stimulation, what breakthroughs might completely rewrite this journey in the next decade? Thank you so much for joining me on this explainer.